Dental offices are set to reopen on Friday, and many are taking extra safety measures to protect patients and staff. But they need more personal protective equipment. We're joined by Dr. Michael Stern from Smile Brighter in Willoughby Hills, who happens to be my dentist. Doctor, first of all, thank you so much for taking some time out to join us this morning. And everybody talks about my white teeth, and I always give you credit. Thank you very much for that. Anyway, you guys have been closed since what? Since middle of March?
Yes.
My goodness, that must be brutal on the pocketbook.
Yeah.
Yeah. Let me ask you this. Considering, you know, how close you work with patients and your assistants, you guys are kind of in there pretty close. Were you surprised that dentist offices were in the first wave of openings?
I think it took a lot of us by surprise. We were expecting maybe mid-May, possibly later in May.
Mm-hmm.
So a lot of us are still scrambling to get all the PPE that we need. Ironically, you know, a lot of us donated PPE to our first line medical personnel, and now some of us are scrambling to get our own.
Wow. Now talk about the, PPE, but talk about the other safety measures that you're going to put in place for you and your staff.
The Ohio Dental Association, as well as the American Dental Association, they have given us a checklist, and I can go through some of it.
Okay,
A lot of it is stuff that if you've gone to another healthcare practitioner, you've already experienced. To try and keep social distancing in effect, we are told to limit patients on site to just the person we're working on.
Just one person?
One person per practitioner. So if it's me and I have a dental hygienist, Kara, between the two of us, we would each have a patient in the facility. Now, we have 6 rooms in our facility, but, then after you see somebody, you have to do high-level disinfecting of all the surfaces. And that's going to take a lot of time between patients.
Yeah. Go ahead. Yeah, what are they going to take the temperature of the patients before they get to your office or before they sit down?
Yes. Absolutely. We've got, and it took us a while, but we have one of those infrared thermometers, a no-touch forehead thermometer. Yes. If somebody has a high temperature, that's the end of it right there. They're not going to come in. We're lucky we have a freestanding building, so we can have people pull up in their car and call us when they're there. Yeah. And we can meet them and take the temperature just as they enter the facility.
Now, you've ordered some special equipment, or have you, as far as just so you can get back in the business?
Absolutely. The biggest thing that people are concerned about in dentistry and the CDC is the aerosols that are generated when you're working on somebody, So we have been fortunate enough to get what I'm calling a HEPA oral particle evacuator. I abbreviate it as HOPE. But what it is it looks like an elephant's trunk, but the end of the trunk goes right underneath the patient's mouth.
Okay.
The suction is so powerful that if we're not using it to get all the particles and spray away from going into the air, which it does an excellent job of, when we're not using it, if we keep it on, it acts like a high-end HEPA filter, and it can change the air in it. 10 by 10 treatment room in 5 minutes.
Wow.
Okay. I can go on and say additionally, a lot of people that have been able to, which is including us, we have somebody over at the office today going into the heating and cooling system, putting in an ultraviolet light to kill viruses as the air goes through the system. And also we're installing a fresh air and stale air exchanger. And this is stuff that was recommended by the CDC. So not all offices can do that. We're just fortunate because we have a freestanding building and we have our own system.
Well, the key is keeping the patients as well as your staff safe, and it looks like you're well on the way to doing that. Dr. Stern, thank you so much for your time this morning. Appreciate it.
Pleasure. Thanks.
All right. I'll be seeing you shortly.
Oh, yeah.
Still